So good morning. My name is McLean Gutt, and I'm the local wellness policy coordinator at the Boeing Center for Children's Wellness, which is in the Department of Pediatrics at the Medical University of South Carolina. I am coming to you today from Florence, so just don't mind my background. And we are so excited to have you here today. My co-host is Erica Ayers, who is the school wellness consultant with the Division of Nutrition, Physical Activity, and Obesity Prevention at DHEC. I am a member of the school's network, and Erica is the executive director of the South Carolina Governor's Council on Physical Fitness. The mission of the South Carolina Schools Network is to identify and promote healthy eating and active living strategies in South Carolina public schools that empower key stakeholders and encourage collaboration among those seeking to improve student health and academic achievement.
Thank you, McLean. Again, my name is Erica Ayers. I'm the Executive Director for the Governor's Council on Physical Fitness. The mission of the Governor's Council is to support the health of all South Carolinians through advancing physical activity. And they're currently focused on supporting student health and fitness, which is why we're working together with the schools network. And an example of this collaboration is this webinar series. So the purpose in the webinar series is to enhance collaboration between schools and communities using the whole school, whole community, whole child model as a framework to support student health. So why are we doing this? This is just one snapshot of data on the status of student health in South Carolina, just one example of that. So 1 in 5 children ages 5 to 11 have at least one untreated decayed tooth, and this percentage is 2 times higher for children from low-income families. So again, this is just one sample of data of what it looks like for our South Carolina children's health. So what can we do about this data? How can we make sure that all of our students have access to healthcare and an opportunity to be healthy and ready to learn? We work together. And that's why we use the whole school, whole community, whole child model. Not to bore you with this very complicated graphic, but it in a nutshell calls for greater collaboration between schools and communities across multiple sectors. So while the schools network and the Governor's Council are all very focused on healthy eating and active living, we see how this aligns with the other components of health and how it's important for the student to be healthy in all of these areas so that they're ready to learn. And so what does this collaboration look like in South Carolina? Or what does this whole school, whole community, whole child model look like in South Carolina? That's what our panel today is going to share with us. More specifically, they're going to talk about how the community involvement component and the health services component can help children be ready to learn. And so before I pass this along to McLean to introduce our panel, we're going to open up our first poll because we want to make sure that our panelists are aware of who's participating today. They got a little bit of that in the chat, but we're going to open the poll as well. So when you're ready.
Oh my gosh, I'm muted. The poll is, have you ever used a telehealth service? Your choices are yes, no, never heard of it.
McLean gave a teaser. That's our next poll. It's okay, you're multitasking. So for this poll, getting a better idea of who you are. So looks like everyone answered, so thank you. So let's see, we're about 35% state agency or state organization. So we got some state representation, and then about 35% school district or school administrator, and 25% school staff and teacher, and 5% other. So those who are other, if you haven't shared what that is, if you wouldn't mind putting that in the chat box right now. And so I'm going to now pass this along to McLean, who's going to introduce our panel and cue our next poll. Thank you.
Yes, thank you. All right, you guys got just a glimpse behind the curtain. So our esteemed panel today is my colleague, Jennifer Stinzi. She is a nurse and the school-based telehealth presenter, as well as a program coordinator. And then we also have the Executive Director of Healthy Learners, Miss Amy Splittgerber, and we are so excited to have you both here today to talk to us about how the whole school, whole community, whole child model relates to health services. Okay, so the poll for you all, it should be up on your screen. Is have you ever used telehealth service? Seeing a lot of yeses so far and some nos. So that's great. So it looks like 61% of you have used telehealth services before, and 39% said no. So I'm super excited to see that, you know, no one has never heard of it. That's exciting. I think the pandemic has really opened up telehealth. So without further ado, I'm going to pass it on to our first panelist, Ms. Jennifer Stinzi.
Thank you so much, McLean. I am Jennifer Stinzi, and I'm a nurse. As McLean mentioned, I work at MUSC in their school-based telehealth program, as well as one of their program coordinators. And I'm very excited to share with you what school-based telehealth is and how it can impact our community and our students. I'm going to briefly go over just the background of telehealth and how it came about, and then transition to specifically school-based telehealth and the different areas that it can serve our students. Telehealth started in South Carolina way back in 2013, where the South Carolina legislature funded MUSC to create a statewide telehealth network known as the South Carolina Telehealth Alliance, with the ultimate goal of expanding telehealth initiatives throughout our state. The MUSC Center for Telehealth is the headquarters for the South Carolina Telehealth Alliance, and it's basically a collaboration of many healthcare systems and providers across the United States. Their goal is to provide South Carolinians with access to high quality healthcare, regardless of where they live. Our Center for Telehealth has over 80 successful telehealth programs, and then includes telestroke, as well as tele-ICU, and then ultimately the school-based telehealth program. The reason why we started is because we noticed that there are significant health disparities in South Carolina. 25% of children live in poor families, and the majority of the state is designated as medically underserved, as you can see by the blue in this graph. All of those are medically underserved areas. 36 out of 46 of our counties are either considered rural or partially rural. There are 7 counties that have no hospital whatsoever, and there really is only 73 active patient care primary care providers per 100,000 population. So why school-based telehealth? Rural and underserved families face significant barriers to access care, whether it's issues with seeing a specialist, issues with scheduling healthcare, appointments, transportation issues, financial barriers, or even a limited availability of healthcare providers that they can see. School-based telehealth provides care in the school setting, where a provider is able to serve multiple schools on the same day, which improves efficiency and helps improve sustainability of the program. When you're able to get a child to see a provider in the school system, it helps improve attendance, it helps keep parents at school, allows to address the transportation issues, and then also helps prevent ER visits, which are preventable ER visits, I should say, and subsequent hospitalizations. So what is the school-based telehealth program? And this is the really exciting part. We are able to provide high quality healthcare to students in the school setting using telehealth technologies. These telehealth technologies has expanded throughout the year. throughout the years. But regardless, we are always able to use HIPAA compliant video conferencing, as well as specialty equipment such as special stethoscopes so that the provider can actually hear the student's heart and lung sounds, otoscopes, and specialty cameras so they can look in the eyes, actually look in the ears, into their nose and mouth, as well as look at the skin if they need a rash exam. The program is intended to reduce ER visits, miss class time for students, miss work time for parents, and then address the transportation issues. All of this is exactly the same as they would have in person. This is what our telehealth equipment look like. It's the same telehealth cart that they have at the school nurse office, as well as the emergency departments for specialty neurological exam for stroke patients. So big picture wise, how does it all work? First of all, our students have to have a special consent. We try to get the kids consented at the beginning of the year, so when they do need an appointment, we don't have to worry about getting a consent on file. Regardless, if a child does need to be seen, the school nurse can work with our office to get that consent done that same day. After the child has a consent, the school nurse will identify a student that needs a visit. The school nurse will then call the parent and let them know that the child is sick and would benefit from seeing a provider. And then she would request a visit with the provider using one of our platforms. On average, from when the nurse requests the visit to when the provider sees the patient is about 7 minutes on average. So it doesn't take very long at all. The provider will then connect with the patient and then do a full comprehensive exam. And at that point, we'll decide, does the student need a prescription or not? And then they will send the prescription electronically to the pharmacy of choice. And either the parent will pick up the child and send them home, or they'll go back to class. There's different types of care that's provided with our program. We either have urgent care type illnesses, such as pink eye, strep throat, sore throat, allergy symptoms, things as simple as a lice assessment or even a rash exam. Anything that you would consider where you could go to the doctor for just a primary care visit or an urgent care visit, that's the things that we see. We encourage, if it needs to be seen in the emergency department, to go to the ER. We also do chronic disease management such as asthma and ADHD. As far as establishing a virtual urgent care clinic in the school system, is we provide basic equipment to all of our schools that have a telehealth cart. We have rapid strep tests, urine test strip for urinary tract infections. We also provide basic medication such as prednisone, which is used to treat asthma exacerbations, as well as we stock acetaminophen, ibuprofen, and diphenhydramine. It's important to note that these are not standing orders. While we do furnish the equipment and the medication to our school nurses, they're not allowed to just administer it or do the test per their discretion. They would need to have a visit with a provider, and there would need to be an order in place for them to give the medication or to do these tests. So as far as chronic disease management, we have a special focus on asthma management. In many cases, and those of you who work in the school system are well aware of this, many students with asthma fail to bring in their inhaler to the school or bring in the special forms that need to be signed by their provider in order for the school nurse to administer the medication. This leads to issues where students are acutely wheezing and the nurse is unable to treat them. And the only thing that they can do is either call 911 if there's an emergency, or have the guardian pick the student up and take them in to see their provider, or have to go to the emergency department if they can't get them in. So we try to prevent this situation from occurring. At the beginning of the school year, we try to have the school nurses identify students with asthma and get them consented into our program, and to get them to be seen by our provider. And our provider will see these students routinely, either every couple of months or sooner if needed. We will fill out all the necessary forms, and we can write prescriptions for the student for an albuterol, one to keep at home and one to keep at the school. And we also work with our school nurses to sometimes give maintenance medication if they're required while they're at the school. And that's helpful if the parent or guardian is unable to give the medications at home. We also have relationships with local pharmacies that will deliver the medication to the school itself. We also have a wonderful program where we have a respiratory therapist see our asthma students once a year and provide a very thorough and wonderful explanation of what asthma is to the students, help them figure out what their triggers are, as well as speak to the family members as well and provide them with education. We do this all through our telehealth cart as well. So as I mentioned earlier, this program was developed with the specific intention to address population health outcomes, and then asthma was our primary focus. In one school system, we looked at Medicaid students who are enrolled in our program, and we found that there was a 21% reduction in emergency department visits among children with asthma within the first 2 years of this program starting. And then after the third year, there was a 35% reduction. So as you can see, this program is extremely valuable for our students with chronic disease management and helping keep the students out of the emergency departments. We also do ADHD management, and our students see a provider every couple of months, and this is a controlled substance, as you know, with these medications. And so there are different rules and regulations in order to prescribe these medications. Having students be able to see a provider in the school system helps address issues of making appointments on time. It helps, we've noticed that students in our program make the follow-up appointments and use the actual standardized tools in order to help make sure that the medication that they're on is working, or it needs to be titrated either up or down, which all helps improve outcomes for our pediatric patients with ADHD. Now, this is an example that we sent out to parents and how to enroll. It's pretty easy to use. You just need to use an iPhone or your Android phone. Using your camera setting, when you look at the QR code, it just opens up onto their smartphone. We also provide paper consent forms, and we can send out links to families to help fill out these forms as well. And then I'm going to share my screen so I can share this video of one of our students who benefited greatly from our asthma program.
Since I was a little kid, I was doing the keyboard, like I pressed the piano notes.
Timothy is one of those really amazing people who just brings sunshine wherever he goes.
Timothy was one of those kids that always had to be in the office because he was getting sick and he was always needing medical attention. And because we didn't always have a nurse here on site every day, then we had to, in the front office, make sure that we try to accommodate.
Well, I think technology is going to limit this video. But long story short, this student was able to see a provider using our telehealth equipment. They were able to get him on medication management, and he went from being a very, oh wait, here we go. Now it's buffering.
As best as possible.
Over 20 years of pediatric practice, this young man is probably the most severe asthmatic I've ever treated. And I met him about 2 years ago when his principal reached out to our lead telepresenter, Miss Lynn Floyd in Williamsburg County.
Well, the first time I ever saw Tim, he had his head down, he was hunched over, he wouldn't talk to me, he wouldn't look at me, he was very quiet, very withdrawn. And at the time when I first met Tim, his asthma was very poorly controlled. He seemed to be withdrawn and very quiet, but it really was that he was having a lot of problems breathing. Big breath. Good.
He had already been referred to the emergency department twice by ambulance from school. And so we repeatedly met with him, myself, Ms. Floyd, to do asthma education. We also connected him to our respiratory therapist, and she did some additional asthma training with him through telehealth in the school. We provided him with a calendar with stickers so we could track when he's taking his controller medications and when he's taking his acute medications so we could know how frequently he was having trouble.
Well, Tim's mom works at the beach, and so she was not able always to pick up his medicine. So I worked with her permission, and picked up his medicine, brought it back to the school. The school nurse was going to give his medicine. And then the medicines that he needed at home, I went out to the house and talked to his brother and his sister about his medicine. We also talked to his sister here at school, just trying to make sure he understood what to take when. I mean, it took some time, but working with him repetitively for several visits, he figured it out.
Right. That doesn't control the medicine due to your asthma?
Control.
All of a sudden, he became really talkative, and he started telling me about all the things he liked to do and what was going on with his weekend and just kind of things that was going on with his family. So I got to know him a whole lot more, after he got everything regulated.
Tim will actually hold a conversation with you now and tell you all about the things he enjoys. And before, we couldn't hardly get Tim to say anything.
He is very happy now. He is always excited about coming to school, and he is very good about managing his own health care. So when he will come in, we don't have to call for him to come to take his medicine now. He comes at the appropriate time every day. He's taking his medicine, and he's really managing his own health care really good now.
Asthma is the #1 chronic disease of childhood in the whole United States, and it's no different here in South Carolina. It's also the #1 reason that children miss school is for asthma. So it's very important that we think about asthma and its effects on the individual, but also on the classroom and the family and the community. And so with Timothy, as with many others, when you're having difficulty, whatever the healthcare problem, but in particular with asthma, it affects your social interactions. It affects your ability to complete in sports, to do exercise. It affects your ability to concentrate. If you don't feel well, you can't concentrate, and how are you going to learn? So it affects every aspect of their young lives.
We are in an area where, in order for us to get the health care that we need, we have to travel at least to Florence or possibly even Charleston or Sumter or Columbia in order for us to get sufficient health care. It's kind of hard for people who aren't able to travel to those places easily. This particular program is a much needed resource as far as healthcare is concerned.
His mom tells me often that he is not the same kid, that he feels better, he talks more, he laughs, he jokes, he's able to do a lot of the things that he used to like to do. So she's seen a tremendous improvement in him at home, and then we've seen a tremendous improvement in him at school. So I think we've made a big difference in his life.
We do that 1, 2, 3.
He remembers.
Okay, thank you very much. Let me stop sharing my screen. If you have any questions after Amy's presentation, we'll go over questions and answers. You can put them in the Q&A chat, and or you can email me at stinzi@musc.edu if you're interested in possibly your school participating.
Thank you so much, Jennifer. I always learn something new every time you present, and it's incredible to see the work that's being done across the state of South Carolina through the school-based telehealth program. So our next panelist is the Executive Director of Healthy Learners, Amy Splittgerber. And before she tells us about what all she does, we're gonna launch the third and final poll. Have you all ever heard of Healthy Learners? So please answer that. All right, so the answers are coming in. See, right now we have about 36% of you have heard of Healthy Learners, 16 say sort of, and 48% say no. So this is going to be really informative for all of us. Amy, if you are ready to go, the floor is yours.
Thank you so much. I didn't know what to expect, but that is probably what I would have guessed. So I am so excited to be here and to talk to y'all about Healthy Learners, for those of you who sort of know who we are and what we do, and especially to those who have never heard of us. So we have been around for 30 years. To be honest, right after this webinar, I'm getting in my car to a luncheon to celebrate 30 years. We're having a luncheon to celebrate our 30th anniversary. So we were birthed out of Providence Hospital. We are a health ministry of the Sisters of Charity of St. Augustine. And so the presence of the sisters was Providence Hospital. Of course, now that is MUSC. But we have a foundation in South Carolina. We have the South Carolina Center for Fathers and Families and Healthy Learners. And so that is the presence of the Sisters of Charity of St. Augustine. They are an order of nuns in Cleveland, Ohio. And so with the health system, they have other foundations and other health ministries in Cleveland, Ohio. And so that is our charge. We are the hands and the feet of the Sisters of Charity of St. Augustine, and we have been doing the work of the sisters in South Carolina communities, again, for 30 years. So if you could go to the next slide. So we were created, again, in the spirit of the sisters, and we are devoted to removing children's health barriers to learning with love and compassion. And so we see the world where all children are in South Carolina are healthy and able to reach their full potential. And so what are health barriers to learning? And I do want to digress a little bit, and now that I have heard Jennifer's presentation with telehealth, kudos to the organizers of this webinar for pairing Jennifer and I together, not only to have us meet one another, but to really, these Healthy Learners exist for the same reason that telehealth exists, because children are falling through the cracks and they're not getting the healthcare that they need in order to thrive. So if you could go to the next slide. Health barriers to learning, it's really anything that is preventing a child from thriving in the classroom. And there are 8 identified health barriers to learning, and that is vision problems, hearing problems, dental problems, uncontrolled asthma, behavioral health. You could actually stay on that slide. Behavioral health, which is ADHD, mental health, exposure to lead, and chronic hunger. So those are all things that get in the way that sometimes have a simple fix to them. And so if you think about vision, 80% of learning happens through what we see, And so you can imagine if a child is struggling with vision problems, they're not interacting. They're not able to concentrate in the classroom. A lot of times, and there is a direct association with vision problems and academic performance, with also behavioral write-ups as well. Because if you can't see, you can't interact, you're bored, you're moving around the classroom, you're a behavioral problem to your neighbor, etc. Same with hearing. Also with dental, so much dental. Erica shared a statistic earlier on. The dental problems that we are seeing in children are staggering. And so we are going into, I'll talk a little bit about how we do our work, but we're going in and we're doing health screenings to identify these problems so that then we can address them. So if you can, and Jennifer did an amazing job with asthma. So go ahead and talk about sort of what we do. So we provide access to vision care, dental care, asthma control. We provide access to care for behavioral health. And again, we define behavioral health as ADHD types of services. Mental health services, we coordinate care, which is huge. Healthcare is hard to navigate. It is hard to navigate our healthcare system. And so we have fantastic relationships with our medical providers. And sometimes we can get our kiddos to be seen quickly with our medical providers. And so a ton of what we do is coordination of care of services, episodic care. So a lot of the things that telehealth does as well. So if a child has a rash, if a child has an ear infection, anything under the sun, we again provide access to care for that child. Hearing, we assist families with the Medicaid application process. If a child is Medicaid eligible and either their Medicaid has lapsed or they did not know that they were Medicaid eligible, we work with those families to try to get them on Medicaid. And then transportation to appointments, that's huge with what we do. We have a fleet of about 25 vehicles throughout the state, and we keep those vehicles on the road. The other thing that isn't on here is language services, assistance. This is especially exploding in our program in the Midlands. We, about 3 years ago, decided to improve our services to our Hispanic families. And that's kind of a peak of Pandora's box that has just sort of blown wide open. And I would love to talk to folks on the call if that is something that you all might be struggling with as well. Most of these children were not born in our country, and so they're not eligible for Medicaid. And so that is something that we are trying to figure out. So if you can go to the next slide. So these are just some of our statistics. Last year, we were right at 2,000 unique children served with about 9,000 services. You can see the amount of miles traveled. Health screenings is something new for us. And so we had about 7,500 health screenings, which allow us to be more proactive in our services. So that is part of how we are trying to be more efficient in getting children identified and getting children served. And like Jennifer said, everything that we do, we require parent permission. So we have a very extensive not application process, but consent process to get all of the information on our children before we serve them. So next slide is a few more statistics. About 1,000 pairs of glasses, not only new glasses, but replacement glasses. With just like a rescue inhaler at school, we do sometimes with our kids, we have a pair of glasses at home, a pair of glasses at school, so that the children have what they need in the classroom. I talked a little bit about care coordination. That's a number of care coordination hours that we spent last year. And then some of our dental services, both with prevention cleanings, as well as restorative visits. So if you can go to the next slide. I talked a little bit about under the why, the link, the data between, it's sort of intuitive to think that if you provide a child with a pair of glasses, their academic performance probably will increase, and in fact it does. But this behavioral link was very surprising to me. And so you can think, okay, ADHD management, because we do that as well, but the link between dental restoration, a child with severe tooth pain, and vision correction, hearing correction, that link between the behavioral outcomes is really staggering. So so there's huge links between what our work and educational, behavioral, and even absenteeism. Jennifer mentioned, or in the video, it was mentioned that asthma is the leading cause of chronic absenteeism in our children. So hugely important this work is. So if you go to the next slide. So how we do our work, go ahead and flip over. So we have in the past been a bit reactionary with how Healthy Learners operates. So we really relied on the school nurses to let us know when there was a child in their school that was either chronically in the nursery, or maybe a teacher is suspecting a vision problem or a toothache or something like that. But in the last few years, we have been trying to be more proactive with our services, and we have done a great job with partnering with school nurses to either do the vision, dental, and hearing screenings, or in partnership with the nurses, helping out with that. And then there, if there is a follow-up for as a result of the screenings, then we communicate with the parents, we provide them information on Healthy Learners and get that parent consent back. And then again, we do all of the care coordination, and we, in our vehicles, pick the children up, take them to care, bring them back to school, or bring them back to home, or bring them back to after school or summer camp or the Y, or wherever they happen to be. And any kind of follow-up, a lot of times some of these dental issues are so severe that they require 2-3 follow-up visits. Of course, we plan all of that. If there are glasses to pick up, we deliver the glasses back to school. Prescriptions, we deliver the prescriptions back to school. Sometimes in the car, if it's a dental vision or if it's a dental visit, we'll ask them, have you ever been to the eye doctor? Or if there is something else that comes up, or do you have siblings at home? So we really do try to be proactive and making sure that that child gets exactly what they need to thrive in the classroom. So if you could go to the next slide. So this is where we are. So that was very curious as to, and why I asked the question. We are not everywhere. We are not statewide. In the last 3 years, we have, we are definitely growing. So in the last 3 years, we have, so I've been with Healthy Learners for 3 years, and I was hired to try to figure out how we could serve more kids in more communities. And we are doing that. We are growing into sort of this regional approach. So we have 4 regions. We have upstate PD, Midlands, and Low Country. The darker areas are where we're serving. Where our logo is where we have physical offices. The lighter of the counties are sort of the counties that we have our eye on, that we would like to serve. And eventually, we would love to be able to establish service delivery in anywhere where we are welcome. So for those of you that are on the phone, I'll share my contact information and we can talk. So if you could go to the next slide. One of the huge solutions to us trying to figure out how we can serve more children and how we can serve more children in more communities sustainably, of course, is our partnership with AmeriCorps. And we had a planning grant in 2000. Last year, we had our first full year of AmeriCorps, so we're in year 2. And these were our AmeriCorps members last year. 3 of them are still with us, and we have 4 additional. And they are really providing us with more boots on the ground. And it's really a huge help to us to be able to be in more communities. So if you could go to the next slide. And the last couple of last things I wanted to do, this is the video that we have, this is about 2 years old. At lunch, we have a new video that we are going to be showing to our partners later on this afternoon, but I did want to show our older video. This was done in 2000, but it's still absolutely relevant. So if you could play that, Erica.
For some people, it's tough to take off, to take a child to the doctor. But with this program, I'm one of those parents, if my child is sick, it's like I'm sick. It's a burden on me. And if I have to leave my child to go to work and my child is sick, that's not a good feeling for me at all. For some people, it's tough to take off, to take a child to the doctor. But with this program, I was assured that they would get to their appointments and get back to school and everything was fine. I was very happy with that program. Very, very.
Good morning. How you doing?
Healthy Learners is primarily the bridge between families and healthcare.
It's nice to meet you. Yes. Are you ready to go with me today?
We just take it for granted that that parent can take their child to the eye doctor to get the glasses. But sometimes, especially in some of our more rural communities, that's a half day, it's a full day off of work, and they simply can't afford to do that.
We just had a student recently that came in, he couldn't eat because he had such bad dental issues, and for whatever reasons his insurance had lapsed. So I contacted Healthy Learners. They were able to get the student in for emergency visit and provided care, and that student has gone around just raving. He was excited. Yes, kids learn better when they're healthy.
All right.
If a child is sick, they're going to be absent from school and they're not going to be learning. Education is a way out of poverty. Well, to be able to have that education, a child needs to be able to be in school to learn. And that's the connection that we make with Healthy Learners. Your shoes untied, be careful. We have a lot of very hardworking families doing everything they can to provide for their families, and sometimes they need a hand up.
Say ah. Ah. We just want to see these kids. We want to make sure that they're taken care of. You know, those are kids that in our system today, they're being left behind. And I think that that's where Healthy Learners steps in. They're closing the gap for these kids. Donations to them, man, you're making the kids see. You're helping them with their teeth. You're making sure they're getting out to their doctor's visits. When you see that lens go in front of that child and they're able to see what they haven't ever seen before, that's that moment. A lot better?
I can read it. I urge parents, please take advantage of this, because Healthy Learners is a big help to you, your kids. Everyone's healthy, everyone's okay with work, and it is a blessing, very much a blessing.
So I think I've got one more slide, and what I'd love to do is tell a story of a recent child that we served. His name is Jadavian. So Jadavian is a 9-year-old boy who loves playing football, wrestling with his 2 older brothers, and going fishing with his dad. He loves special evenings, going to Wendy's to get a macaroni bowl after his mom finishes her shift at work there. Jadavian lives with his father, 2 brothers, aunt, and grandmother in a 2-bedroom, 800-square-foot house in Columbia. He is bright, happy, creative, and a real jokester. Healthy Learners met Jadavian at his local school after a call from his school nurse. He was struggling to focus on school because his teeth hurt so badly. 3 of his teeth were rotting and needed to be pulled, and 3 others needed fillings. Getting Jadavian to the dentist and getting the work needed would not be easy. His father was legally blind, suffering from a degenerative eye disease, and his mother's work schedule was challenging to coordinate with. They also were struggling to make ends meet for their family and needed help. Healthy Learners met with Jadavian's dad and helped enroll his 3 sons into Medicaid, and then coordinated with a dental provider to get Jadavian and his 2 brothers scheduled to see the dentist. Healthy Learners transported the boys to and from school and made sure everything was set for Jadavian and his brothers to receive care. Jadavian was afraid when he got to the dentist, but after some time marveling at fish in a fish tank and at the dentist office with the Healthy Learners staff member, his fears subsided and he bravely let the dentist take care of his mouth. Jadavian got his 3 rotten teeth wiggled out by the dentist and is scheduled to have his fillings in October. Jadavian is just one of 2,000 children that Healthy Learners will serve this year. This story is multiplied again 2,000 times. We are on track to serve. Our goal this year is 2,300 students, and we are definitely on schedule to meet that. There are so many Jadavians out there, and so I think the next slide is, I think, just my contact information. Oh, no, my staff, sorry. So this is the Healthy Learners staff. We are just ready to partner with anybody who is interested in learning more and can help us connect to kids to get them served. So then the next slide, I think, is my contact information. Thank you.
Thank you so much, Amy. It was really powerful to hear your story and hear what you and your staff do at Healthy Learners in South Carolina in tandem with Jennifer Stinzi at the MUSC Center for Telehealth. And now I'm going to turn it over to Molly Mills to address some questions that have come up since you both presented. And again, I'd like to thank you both so much for the work you are helping to facilitate in the state.
Yes, thank you all. This was very informative and interesting. We've got lots of good questions, and we only have about 8 minutes. So we're going to answer as many as we can, and then we'll follow up on any that we might miss. So Jennifer, I'm going to start with you. The first question looks like it's from Diane Walker. It says, is it possible to perform school physicals through telehealth care? We have numerous students wanting to participate in athletics, but cannot get a physical because of lack of funds or transportation.
So long story short is both yes and no. We don't turn away visits when requested. We try to steer away from the physical ones for athletics do better in person than over telehealth. We can provide exams like that, but we try to get those students to go to their home physician for those.
Very good. And Jennifer, while we have you, another question. This is from Miss Janet Duff. Can blood work be drawn and sent to a lab with a provider order?
Yes, yep, we can do that. Most students that need lab work done, it's not very common, but we are starting up a partnership with MUSC endocrinology to get some student to have appointments with the endocrinologist while at the school office using a doxy platform, not really needing the telehealth carts. And we can send lab orders to their local lab sites. It doesn't have to be MUSC to get labs drawn.
And one last one for you, Jennifer. It looks like a lot of people are interested. So for next steps, should they just contact you, or what's the best method?
Yes, please send an email to stinzi@musc.edu and I will forward it to our program manager.
Very good. And one more came through, Jennifer, before I get you off the, so what does the training portion for school nurses consist of for the telehealth program?
Yeah, so any schools that have a telehealth cart in it that does not have a telepresenter like myself, we do yearly trainings with our school nurses and ad hoc trainings. So we give the school nurses our contact information. So if they have to do a visit that day and they don't really do them very often and they need to troubleshoot how to have and how to do an appointment, they have a contact who can walk them through how to do the appointment. Otherwise, like I said, we do yearly trainings with our school nurses.
Very good. Thank you so much, Jennifer. All right, Miss Amy, we've got a few questions for you and about 5 minutes left.
Okay.
So Amy, got a lot of positive feedback on the asthma management story. What are challenges faced with accessibility of telehealth within rural communities? And as I read that, that's actually Jennifer. I apologize. I'm sorry. So Jennifer, any challenges?
Yeah, the biggest challenge is Wi-Fi access. A lot of these schools in rural areas don't have very great Wi-Fi, but we use a special port using our IT that connects directly to it's like a special firewall that allows access better, but the biggest one is Wi-Fi.
For sure. All right, Amy, I promise I have some for you. So is there cross collaboration with state level dental / oral health organizations for greater reach?
Yeah, so because we are growing into statewide reach, we haven't partnered with statewide associations on a statewide level, but that is definitely, as we are now developing and living into our new strategic direction, I think we can start to begin to have some of those conversations. We have begun to have conversations with some of the MCOs, because that is also a huge piece of our work.
Very good. And obviously that's the purpose of these webinars too, is to create some of that cross collaboration. So I'm glad that's where people, people's wheels are turning. So what are the funding sources for Healthy Learners, and what do these sources actually fund?
Yeah, so we have a comprehensive fund development plan. So we are a combination of individual donors, cultivating large gifts. We have a huge pot of our funding comes from specific grant sources, either from a statewide level or in specific counties. And some of the grant writing I had mentioned earlier, that, for example, the funding for medical fees for mostly our Hispanic families. That has skyrocketed, especially with dental. So we're seeking opportunities specifically for that purpose. A huge funder recently has been Delta Dental. So grateful for their support. And then the last piece is our events. Hey, while I'm talking about events, we do have our Songwriters in the Round event. It's a fundraiser coming up. It's on October 7th in the Midlands and on October 8th in Georgetown. So see me if you're interested. Shameless plug.
I love it. That's great. And then last question for you. How do you prioritize which children receive your services since there is such a need?
So we don't ever turn anybody. So we have a 95% service rate for the children that we get consents on. So if we get the consent, we're gonna serve that child. And the 5% is really just when we do our calculations, probably we haven't gotten to their appointment yet. So if we get a consent form back, we will serve that child. The trick is getting the consents. And so what we're trying to do is do a little bit of trust building in some of our communities. Again, we've been in some of our communities for, again, 30 years, for 20 years. And so as we go out, like, for example, we've been in Allendale for 18 years. We now are serving the children in Hampton. We're having to build trust in Hampton. And so, so that is some marketing and things that we are trying to just really cultivate and educate the parents on what we do. Another way of looking at that is, how do we prioritize where we're going next? And with that, it's a combination of need plus assets, resources, meaning providers, school districts that are eager and excited to partner with us, and funding sources. You know, we've got to be sustainable. So.
Very good. Well, thank you so much, Amy and Jennifer. As you can see, their contact information is still on the screen if there's any other burning questions that you have for them. I'll pass it back to Erica or McLean if they want to close us out.
Thank you, Molly. And another big thanks to Jennifer and Amy. Y'all provided some great information. Like Molly said, one of the purposes in this is to create awareness and some cross collaboration. So we hope that y'all's presentations lead to this, and your inbox is just filling up right now. I hope so. Just another big thanks to Holzbeier for coordinating and hosting this Zoom webinar series. Really appreciate it. They did record it, so that recording will be shared out as a follow-up and also posted on their website. So be on the lookout for that. Also, if you need a certificate of attendance, please put your first name, last name, and email address in the chat box, and we will make sure that gets to you. So again, if you need a certificate of attendance, please put your first, last name, and email in the chat box. And then just a reminder, because I know we're out of time, but just a reminder, this was just number one for our 3-part fall webinar series. And so we're going to explore the other components of the whole school, whole child model. So make sure that you save the dates on your calendar. October 19th, we'll be looking at social emotional learning and adverse childhood experiences. And in November, we'll be looking at how to support family engagement. So these links for registration will be in your follow-up emails, and then we'll also start sharing them today or tomorrow through our network. So when you receive it, make sure you forward it along. And again, just a big thanks to the folks who helped coordinate this webinar. And then another big thanks to Amy and Jennifer. And everyone, please enjoy the rest of your day.